Hello guys, today we are going to talk about carbon monoxide poisoning. Carbon monoxide is a colorless, odorless, and tasteless gas produced by incomplete combustion. It is a major cause of accidental and intentional poisoning worldwide. Common sources include charcoal stoves, generators, car exhaust fumes, and fire smoke. Breathe. Poorly ventilated rooms greatly increase the risk of poisoning. Carbon monoxide binds to hemoglobin with over 200 times the affinity of oxygen. This forms carboxyhemoglobin and reduces the blood's oxygen-carrying capacity. It also causes a leftward shift of the oxygen dissociation curve, impairing tissue oxygen delivery. It additionally disrupts cellular respiration by binding to mitochondrial enzymes. Symptoms depend on exposure level and patient vulnerability. Early symptoms include headache, dizziness, nausea, and general weakness. Moderate exposure can cause confusion, chest pain, and shortness of breath. Severe poisoning leads to seizures, coma, arrhythmias, or death. Diagnosis requires blood co-oximetry to measure carboxyhemoglobin levels accurately. Normal levels are under 3% in non-smokers and up to 10% in smokers. Levels over 25% typically indicate severe exposure. Management begins with removing the patient from the exposure source. Administer 100% oxygen via a non-rebreather mask immediately. High-flow oxygen reduces the elimination half-life of carbon monoxide significantly. Consider hyperbaric oxygen therapy for high COHB levels or neurological symptoms. Supportive care includes treating seizures, arrhythmias, and metabolic acidosis. Cardiac monitoring is essential because myocardial injury is common. Observe patients for delayed neurological problems that may appear days later. These include memory problems, personality changes, and movement disorders. The prevention involves proper ventilation when using fuel-burning devices. Avoid indoor charcoal use and never run generators inside living spaces. Regular maintenance of heaters and engines reduces the risk of exposure. In summary, CO poisoning causes hypoxia, cardiac stress, and neurological injury. Diagnosis depends on co-oximetry, and treatment is centered on high-flow oxygen. Hyperbaric oxygen may prevent long-term complications in severe cases. Awareness and prevention remain the most effective tools to reduce mortality. Thanks for watching. This is Dr. Chabs.